Hello, welcome to our live. I see Noelle is here. Very exciting. Cool. And Noelle, I'll add you in just a few minutes. Just waiting for a few more folks to join our live. Very excited to have this conversation today about Starbucks baristas and staying safe at work. Awesome. More folks are joining. Hello, hello. Welcome. And can everyone hear me okay? Let me know if you can't hear me. That would be great to know. Yeah, very excited. Thanks for everyone for joining this afternoon or evening, wherever you are. Feel free to drop in your location in the chat. Love to know where folks are coming in from. Personally, I'm in Washington, D.C. today. Audio sounds great. Okay, good to know, Noelle. Thank you. Awesome. We'll just give it just one more minute to see if some other folks join before we get started. Awesome. Hope everyone's having a good afternoon. I know I have had plenty of iced coffee today, so I'm ready to go and have this conversation. Chicago, great. That's awesome. So we got East Coast, Midwest, and West Coast represented already. That's awesome. Very exciting. Cool. All right, let's just give it a little bit more time and then we'll just get started right into it. While you're waiting, for folks who want to check it out, there are some great links in our bio, links to posts that Noelle has written, as well as to Coventry Talk, which is a project of Last Mile, and we'll get into the details on that and all of the amazing tips they have for how to stay safe at work in our conversation in just a few moments. All right, cool. Well, I'll just do a quick intro, then we can just jump right into it. All right, cool. So this is the third in a little series that we're doing at coworker.org, where we're talking with baristas, answering questions from partners, as well as bringing in experts in the field of workplace health and safety to answer questions about how to stay safe at work in the context of a pandemic. But we know there are a lot of issues that go beyond just COVID as well. So we're here to offer information and support. Coworker.org is a nonprofit organization. Tens of thousands of baristas have started or joined campaigns on our petition platform that we run. And we're really here as a resource to help folks organize to improve their workplaces. And it's great to see Starbucks workers taking advantage of that. In the past, they've run campaigns around safe needle disposal, increasing paid parental leave, getting wage increases and better scheduling practices. And yeah, this is our third, as I said, in a series of Instagram Live sessions where we're hearing from baristas about the questions related to workplace health and safety that are important to you and getting answers from experts. You can check out all of those previous sessions on our IGTV section of our profile, as well as on our website as well. So feel free to go to coworker.org, that's all one word, and check it out to see some previous sessions as well. So without further ado, I'm going to invite our guest today, who is Noelle Tankard. She's a former Starbucks barista. She is doing awesome work on workplace health and safety right now and has a lot to share about her experience working there. Cool. All right, can you hear me, Noelle?
Yes, hi, I can hear you.
Awesome.
How's my audio?
It's good. I'm getting an echo of myself. Do you have, are you using earbuds?
I am. Would you like me to take them out?
Let's try that and see if it changes anything. Feedback, yeah, okay.
How is this?
Okay,
Still an echo?
that's better. And I can
Great.
still hear you, and I don't hear me, so that's great. I don't want to hear my own voice, that's for sure. Awesome. Well, Noelle, thank you so much for being here and for taking the time to have this conversation with us. I know, first of all, you have a really interesting background beyond just working at Starbucks as a barista, doing all kinds of great work with conservation efforts and stuff like that. But I'd love to, if you could just tell us a little bit more about what brought you to Starbucks. What is your background related to working as barista there?
Of course. Yeah, I was a Starbucks barista for the first 8 months of the pandemic, and that was actually my third time being employed by Starbucks. So the first time was in high school. It was my very first job. The second time was while I was in college, actually in the UK. So UK
Wow.
Starbucks, different company. I studied archaeology and anthropology and then went to work in wildlife conservation in Asia, in
Wow.
both Indonesia and Malaysia, with orangutans mostly. So I'd been
Awesome.
doing that mostly as a volunteer, but I had really enjoyed that work, but needed to move home and figure out a more sustainable career path. So I'd come home, was living with my parents, went to a couple of staffing agencies, and took a job at Starbucks. And that was just a
Wow.
couple months before the pandemic started.
All right. And so that was being thrown right back into that experience. So yeah, let's get into it. I mean, what was it like working in the early days of the pandemic? Tell us a little bit more about what that experience was like.
Yeah, the first couple of months or even the first few weeks were really intense. You know, everyone was scared, everyone was confused. I had had experience wearing a mask before because when I worked
Hmm.
in conservation, I had to wear a mask around the orangutans. So
Wow.
I knew going into it, I was a little cocky for myself. I thought, oh, I've got this. I know what it's like. But I knew people would struggle to learn. And then I realized, putting one on for just half an hour here or there is very, very different than working an 8-hour shift doing manual labor in
Hmm.
that mask. So in the beginning, I was really just trying to do what I could to help coach both my coworkers and customers around the masks as delicately as possible. It was tough with the customers in the first few months. We got a lot of harassment, but we were very together as a team.
Hmm.
All of us working, including the management, trying to figure out the headlines as they happened. It was probably towards the late spring, beginning of the summer that things started to change a little bit. We'd been overwhelmed, we'd been understaffed, but we'd been, in the trenches fighting, doing what we could. And
Hmm.
by the summer, things really started to split along political lines. So there was a
Hmm.
lot less support and consensus about the significance of safety measures, about what was really going on with the pandemic. We saw
Hmm.
this both with the customers and internally. And then from management, there started to be a lot more pressure to disregard the safety guidelines, just to keep the customers happy. It
Hmm.
had been confusing from the get-go, but it got a lot worse by the summer.
Wow. Oh, that's frustrating. And around that time, so do you remember when mask mandates at Starbucks rolled out? It took a little while. I mean, there was a lot we didn't know. So somewhere
Yeah,
around that summer, is that right?
yeah, that's a good question. I wish I remembered the specific
That's fine.
date,
No worries. No
but
worries.
what happened, the sequence, I believe, and I asked to wear a mask before it was mandated and was told I could
Wow.
not. And
Interesting.
then we had Starbucks policy for the staff to wear masks,
Hmm.
but nothing for the customers.
Got it.
And then
Okay.
that began to come in some counties and not others. And I actually worked in a different county than where I lived.
Hmm.
So did a number of the other baristas. So we were crossing county lines. We were trying to
Yeah.
track the two different sets of guidelines. And I believe that the Starbucks policy would have come in the spring, but we were still being told by our supervisors and managers not to offer masks to customers, not to enforce it, even
Hmm.
after LA County had mandated. So it was not
Wow.
until it became federal that there was support for that. And
Hmm.
actually, it was in June that I was transferred from my original store to a second location. And
Wow.
part of that is because I'd begun to voice my concerns about the safety issues.
Wow. Okay, so let's get into that. So, what were some of the top concerns that you had that you wanted to express to management, and then how did those initial conversations go?
My major concern was always masking.
Yeah.
The
Hmm.
importance of making sure that we were wearing masks as well as the customers.
Hmm.
Because I had a previous background with that, because I was following the science of aerosols and airborne transmission, it was
Hmm.
really concerning to me that this wasn't being taken seriously. I
Hmm.
was asked to allow customers to remove their mask and taste their drinks, even while indoor dining
Hmm.
was not prohibited in LA County.
Yeah.
And I tried to be a little bit patient with the understanding that the science out there, the headlines and the media were still very confusing.
Sure.
There was contradictions coming from different parts of government, but I felt that the safety measures were not adequate for airborne transmission. That, having someone unmasked on the other side of the room is still a risk. It's not just about those 6 feet. And regardless of the safety measures, in my mind, from the government, weren't good enough. But we were not managing to even meet those guidelines themselves.
Wow.
Not just not managing to, because we were so understaffed that we didn't have the ability to properly handle the capacity limit or, safely interacting with the customers and following the new methods. But we were actively being pressured by, I had multiple store managers, a district manager. I was informed at one point that it was the regional manager who came in and was part of the removal of our distancing signage and the plexiglass for aesthetic reasons.
Interesting. Okay. Yeah. Well, that sounds frustrating. And I know the theme that you're bringing out here too of, understaffing and just the pressure that you were under. That's something that I've seen come up a lot in conversations with baristas. So it's really useful to have that context when, you're expected to keep people safe, keep capacity levels a certain way, keep customers happy and keep that customer connection while also, feeling understaffed and getting conflicting messages. That does sound like a stressful situation to be in for sure. So you started raising these concerns, and what was the response? How did things go when you raised some of the concerns with your managers?
At the first location, I did not have a great relationship with that store manager, so I didn't feel comfortable sitting down and having that conversation. I was having those conversations with my coworkers, and so it was the manager who called me in. And the first time we discussed it was when I was asked to consider transferring stores. At the second store, I had a lot more conversations with my coworkers there, and then we had a new manager come into that location. And so verbally, I felt like we had great communication. And we were concerned. We were doing the best we could. It might not have been everything, but we were trying. But as it started to get more serious, the case rates were going up. We had more and more pressure from the district manager to keep things normal. The district manager actually himself was there one day, and we were nearly triple our capacity limit. And he ran that shift, that capacity level, not allowing up and asking for stuff out. He was there, he was present, he was observing. So I sort of knew the dynamics were a little bit complicated. And when I finally put something in writing, sent a letter, an email to the district manager, it took a while to get a response back. The reason I chose to contact him was I was told by the store manager that, this pressure, this is coming from the district manager, you need to bring it up with him. So he ended up coming in to have a sit-down face-to-face, which was very uncomfortable, including the fact that his mask was not over his nose while we were talking at less than 6 feet.
That doesn't help. Yeah.
No, I wish I'd said something at the time, but I didn't feel comfortable at the time. So it very much felt like I was being sat down and grilled. And I did my best to get through that conversation. Was a little shaken up. After that, we weren't pressured for a few weeks, maybe a month or so, about the safety issues, which were primarily reminding customers to please keep their masks on. I had spoken a lot with my coworkers, and it was, it was difficult, especially when we were so understaffed. I did end up just before Halloween, actually. The day before, my store manager once again said that we are no longer allowed to remind customers to wear masks. And I said, okay, well, we've had this conversation before. I have informed you in the past that I am not comfortable with working here, if that is the case. So I went home that day, took some time to think about it, wrote up my concerns, sent a letter to the district manager, this time CCing corporate. The ethics and complaint email address was the only one I could find. There's so many phone numbers out there. Very few ways to put anything in writing. And waited for a response. I did not get any engagement. The district manager had an auto reply email saying he was out of town. Store manager texted me just asking if I wanted to keep my job. No response about the safety issues I'd highlighted. So I finally decided to file whistleblower reports with Cal OSHA and with LA County Public Health.
Mm-hmm.
And at the same time, wrote a letter of resignation that I felt I would be able to share publicly to try to help communicate in the big sense what was going on and why
Mm-hmm.
this was difficult. But at the time, it was right before Halloween. Case rates were really going up, and I was very concerned for my family. I live with my parents. My mother is immunocompromised, so I'd been distancing and wearing a mask at home and trying to keep them safe. And I was really lucky and fortunate that they could afford to support me if I did quit and lose my income. It was a very difficult decision to make, but I was privileged to be able to have that choice.
Yeah. Well, so that's great. Yeah. I mean, you did resign and you ultimately shared that letter publicly along, but you didn't just leave it there. You also shared a lot of tips and resources for other employees, and also heard a lot of stories from other baristas when you shared your story that were similar. So I'd love to hear a little bit more about like the process of putting that all out there to the world. What was the reaction? And also this gathering stories from baristas after that as well.
Absolutely. I think I started going on Reddit a couple weeks before I quit, before I'd even made the decision. I had heard from a few others that there was, information, anonymous tips on there. So I wanted to see what was going on. Yeah. And what I discovered is that people everywhere, in every state, in every city, baristas were reporting the same kinds of issues and pressures that we were facing. So at one point, I had been concerned or under the impression that maybe I was just dealing with one misinformed district manager or one regional issue, but seeing so many people speak up on sometimes the same weeks, the same days. And once I'd sent in that one letter and was waiting for a response, it was Halloween and it was Red Cup Day. And I just sat there on Reddit watching the stories come in and people discussing their mental health breakdowns, showing photographs of stores that were packed wall to wall with bodies, people unmasked, the harassment really spiking. I don't think I mentioned the harassment so far, but that was one of the major issues going on, was how the customers began to treat us. Not only when we wanted to do something to protect ourselves, because so many of these safety measures were designed to protect the customers from us, not to protect the workers. Yeah. And just attempting to follow those put us under a lot of harassment from the customers. And so we had people screaming, we had people throwing furniture. What I witnessed and experienced, including overhearing death threats happening, was what I discovered on Reddit, typical. So I'd been on Reddit, I'd been reading these stories. I didn't start screen capping or saving any of them until after I quit. But I realized I put the letter on my own website initially just to have a way to share it with people without needing to email everyone. Yeah. And after doing that, I realized that I wasn't comfortable trying to take another step towards contacting a journalist or going any further while it was just about what I had experienced. So I posted a few times on Reddit, started talking to other baristas in DMs, and asked if anyone was comfortable with me sharing their stories as well, anonymously. So I think I put up about 20. I'd need to check. I spoke to over 100 different baristas.
Wow. Wow.
All text message, no calls, no voice, no face. But it was really interesting. It was really important for me, I think, to feel that sense of community. But I was talking to baristas who were in isolation or quarantine. I was talking to baristas who had just tested positive that day. I was talking to people who were losing family members, and we were all in a collective state of trauma.
Wow, that's so powerful. I think that really speaks to what so many are going through. And what you're talking about really speaks to like the power of like the collective effort of coming together, sharing your stories, sharing your experiences. As you said, like it's only through that you learn that it's not just like your store or your manager, like you're all connected in this way and experiencing something. And that can be the start of something really powerful. So speaking out and helping to be a person who's uplifting the stories and providing the space for people to speak out and connect with each other and share, that's really powerful for sure. And I should just note that after the live, if folks want to check this out, the link to your post where you put together a lot of the stories that you heard from baristas is in our bio. So it's easy to find if anyone wants to read that after, and I hope you do. And I should also mention that for anyone who's watching, please feel free to share questions, comments, anything like that in the chat. We'd love to hear from you and what's on your mind related to Starbucks and workplace health and safety. Cool. Okay, so you did all this stuff. You're no longer at Starbucks. You like got all these stories from workers. What's really cool now is that you took that experience and a lot of experience in your past, and you're now doing some really cool work with experts to help fix the situation on a much bigger scale. So tell us a little bit more about the work that you're doing with Coventry Talk, which is a project of Last Mile.
Yeah, thank you. It was around, I'd quit around the holidays. It took me a month or two to write things up and sort of process and then go through my own quarantine and isolation periods. And it wasn't until after New Year's that I started reaching out to other activists and other scientists, trying to see what I could do, how I could help, especially trying to promote and spread the awareness of what essential frontline workers were experiencing. Because what I was finding already in my own life is that family and friends who had been work from home were shocked and surprised when I told them what was going on behind the scenes in businesses. So I thought that I would be in a position where I could help to bridge that gap a little bit. And I wanted to use the skills that I had from training as an anthropologist to share some stories. But I'm not a social anthropologist. I'm not a social anthropologist. I can do some interviews. My background is biological anthropology and human evolution and primates. Wow. So I was really interested in trying to properly understand aerosol transmission, airborne transmission, how human behavior impacts and affects all of this. And of course, during the holidays when the case rates were spiking, this was a really critical period. Not that I don't think today is still a critical period, but everyone was in that same boat. The whole world was together in isolation, trying to see what they could do. So I got connected with Last Mile Coventry Talk, and I'd actually used their website and used their materials when I was writing my letter of resignation and my reports to Cal OSHA and LA Public County Health, because they had a really great, simple, clear public communication stuff on their website about the airborne risks. So I focused a lot on mask wearing and on capacity and keeping people distance. And it wasn't until I really went through their materials and then they reached out to me on Twitter that I started to have a better understanding of how air ventilation works. Because a lot of their research and focus had been on working with HVAC and indoor air quality scientists and experts who could do consultations to businesses who wanted to have best practices and be safer, working with unions to try to give them the information they need to apply to their situation. And it was fascinating. It was a learning curve in the beginning for me, trying to grapple with air currents and flow and figure out how this goes together. And it is a lot. But at the end of the day, it really comes down to the fact that everything we're doing is about protecting our air quality. The reason you wear a mask is to prevent the particles from escaping you. And the reason that a respirator or a filtration mask protects you better is it filters the air coming in. But you can also do these same things by maintaining the capacity, by using portable filtration devices in different places of the room, by ensuring that your air conditioning HVAC system has filtration in it, by ensuring that the air is moving in and out. Whether you open a window or whether you install an expensive new device, the end goals are the same. We need to make sure that the contaminated air gets out and fresh air gets in. And so the project I've been working on specifically recently that we're about to launch and come out with is trying to find some guidelines of how this can be measurable and quantifiable.
Okay.
Because air ventilation is left out of so much of the safety materials. And when you do see a reference to it in some of the OSHA documents, it'll be, you know, improve the air quality and make it better.
Sure.
But
okay.
it's not enough just trying to improve it. We need something measurable and quantifiable. So we need to be able, as workers, to see the specifications, the manual for your air conditioning unit, see what it is capable of. We need things like CO2 monitors that can actually measure if the air is changing quickly enough. So forgive me, I got a little long-winded there.
No, that's great. That's great. I mean, you know, those are the details that make such a difference. So, you know, it's important that we get into that. And people are already eagerly anticipating in the chat this resource that you have coming out. And so just to remind us of, like, you know, for folks who might be working in a cafe setting, some of the most important things you've mentioned so far, like that they should have in their workplace are, first of all, masks that are really good at filtration, air ventilation is important, and capacity is really important. What are the top things or other things that we're missing, or what's most important for someone in a cafe setting to keep in mind? And what could you do if you are not seeing those best practices implemented in your cafe?
So the acronym that Coventry Talk was using is MAD, Masks,
Cool.
Air, Distance. And recently we've added a plus to the end, which is vaccine access, whistleblower support, and healthcare. Within each letter of the acronym, you can go super detailed, and I'll try to stay brief. But with the masks, what I've learned through reading the studies is that filtration masks are important, especially right now if you're unvaccinated. But you can actually achieve filtration with a regular everyday mask, as long as you get it properly sealed around your face. So it's more about the gaps in the fit than it is about having a fancy, expensive mask. And whether you're able to put strings on it, a rubber band, buy a mask brace, there are cheap ways you can still help to protect yourself. For me, distance is all about quarantine and isolation and ensuring.
No, I'm just going to pause for just a moment. Something changed in your audio. I'm not sure exactly what. Do you know if did something change in your device at all? The audio went a little weird. Try talking again.
That I'm aware of.
Oh, you're back. That's good. That's good. I think you're good. Cool. So you were talking about distance as well.
Yeah. The distance is really about ensuring that you can separate people out who need to be quarantining or isolating, meaning that you need flexibility in your scheduling, you need to be able to call out sick, you need to have paid time for when you're quarantining or isolating. But I think that specifically for restaurants and service, the capacity issue is major, because your HVAC, your air ventilation system, can only handle so many people, so much breath coming into it. So I think of it kind of like a seesaw, that if you want to have more people in that space, you do need to improve the air ventilation. Or you need to test and figure out how many people the air ventilation can cope with and handle. But the reason this becomes so difficult in cafes and restaurants is that people have all these expectations, all of these memories and honestly entitlements of being able to treat that space as if it's their own, asking for things. So even the tiniest little changes in our strategies, like not having the milk or the sugar out on the bar for them to help themselves, were making people infuriated and enraged. And I think a lot of it was, you know, everyone is in trauma. Everyone was struggling with their mental health. But in restaurants and cafes, if you can keep the number of customers indoors to a ratio where the staff can safely interact with them, both in terms of the air ventilation and just being able to handle crowd control and notice what's going on, then you're much, much better able to stay safe. So I think for me, I quit because of the masking issue, but if it hadn't been masking, it would have been the capacity issue. And if it hadn't been capacity, it would have been the understaffing.
Well, that's a lot. That's a lot to deal with for sure. Okay, we have one question specifically about what filtration mask you recommend, and then there's a barista submitted question that I'd love to share that brings together a bunch of this. And then I can't believe how fast the time is going. We're going to have to wrap up after that. But do you have any recommendations on what to look for a good filtration mask? You said fit is very important, but what about all those letters and numbers and all that kind of stuff?
Yeah, no, absolutely. Thank you for asking. So when I say filtration mask, I just mean anything from a basic surgical, those blue ones that you see a lot, to an N95, which are those hard shell ones that are meant for construction workers. Personally, I wear KF94s or KN95s, which all of the letters and numbers get a bit jumbled, but those are the kind of softer ones that you've probably seen around a lot. But I never expect anything I buy to just fit me as is. You know, one size fits all doesn't even work in t-shirts. It's not going to work on our faces. Our facial morphology and our bones are also unique. So what I've been doing is double masking. And I was lucky that my mom sews, so she was able to cut me masks that fit my face exactly. But even after I washed them too many times, they got stretched out or shrunk. If you have two masks, you can ensure that one of them is sealed right under your eyes, flush against your face, and that the other one actually goes under your chin. Okay. Because otherwise, if there's gaps, the air is going to come in through there. So for me, it's a combination of I don't worry too much about how expensive the mask is, but I make sure that it is under my chin, tight under my eyes, and flat on my cheeks. And however you achieve that, it's all about making sure it fits and it's comfortable, because you also need to talk and you need to be able to keep it on all day.
That's true. That's true. All right. So we're going to go to the barista question. Also, there's a very similar question coming up in the chat. So I'm just going to read out the comment one, and then I'll read out the one that was submitted ahead, because they're very similar. Okay. So the one that, thank you, first of all, to this participant for sharing your question. My store recently started getting extremely busy. I'm talking a full cafe, and our protective plexi layer was recently removed. Would the HVAC still be effective? Our district manager also removed all mask policies, so our cafe is full of unmasked people. And that definitely echoes one of the ones that we got submitted ahead of time, which says, recently my store took away our protective barriers. That made me feel less safe in my own store. As a partner who hasn't been able to get vaccinated, I feel like my safety doesn't matter and is being put at risk just to make customers happy. How can we be called partners when we have no say in what steps we take next to make this a safe space for our partners who work countless hours while being short-staffed? There's a lot there. So I'm curious to hear your thoughts on that and any advice you might have for these folks.
Yeah, there's a lot there. I completely hear and sympathize with not just the fear, but, feeling like you are not valued, that workers aren't valued, that this is about either keeping the customer safe or keeping them happy, not about keeping workers safe. And that's really tough. Specifically with the plexiglass. The bad news there is that your managers should not be removing the plexi, because that is still part of code in most states and locations. So you might want to double check your local health code versus federal guidance, but for the most part, plexiglass is still required. Now, the good news is that even though it's required, it's not actually very helpful. In fact, plexiglass can even be more dangerous than not having it, because of the way that the air current is going to hit it and bounce back off. So it's kind of unique to each room and what the layout is. But with COVID Straight Talk at Last Mile, the work we do, we don't recommend plexiglass at all. And we think that it should be left out of the guidance, that it's much more important to focus on masks, air ventilation, and distance. So yeah, that's a little bit of a tough one, because anytime your manager is violating health code, that needs to be reported, that needs to be documented. I would always recommend you make sure that you are reporting and documenting things in writing. I wish I'd started earlier, even if it's just a text message, much less an email. I had so many verbal conversations that then afterwards I had no proof, I had no evidence. So get things in writing. Don't give in to the temptation to let them just call you on the phone or sit you down for a meeting. If you do have to sit down for a meeting, make sure there's someone else there witnessing it who can also speak and say, no, this is what was said, this is what happened. Try to work together, if you can, with the rest of your coworkers. I was at the point where I was covering shifts in 3 or 4 different locations, including different districts. So I was talking to a lot of different baristas, and each store is unique and each set of people are unique. So if you're not comfortable or able to get support within your own store, see who else you can reach out and talk to. I'm trying to remember all parts of that question. Was there anything that I missed there?
I think you mostly covered it, and I'm seeing some appreciation from the person who asked live that question. Yeah, I mean, I guess really the other piece of this is just really, and you're getting to this now, which is, there's stuff like short staffing and just not feeling valued, and knowing that the company may not be implementing best practices, and like, how do you, what do you do? So you're talking about like documentation, filing complaints, talking with your coworkers, taking, collective action. Yeah, any other thoughts there? I mean, a lot of what you did of like sharing your story and then soliciting them from others, that feeling of not being alone and connecting and seeing what happens from there is important, it seems.
Yeah. It is very difficult and delicate sometimes, I think, to walk the line between providing emotional support to someone or needing emotional support versus figuring out a plan of action. So because I had quit, and I knew that part of the reason I was quitting is so I could speak out more, because it is much more difficult while you're still employed. I'd recommend that if you can, try to reach out, or if anyone else who's watching this has already quit as well and is willing to try to help speak up for those who can't afford to right now. But there's some more we can do once we're outside. But yeah, I think that you need to get your concerns in writing, tough as that is. And I think that for me, one of the things I struggled with was not feeling perfect, not feeling good enough. I knew that sometimes I made mistakes, that sometimes it was my fault that I didn't call capacity or I missed this or that. Don't let that fear of failure keep you from speaking out. Because the reason that the baristas and shift supervisors could not follow safety guidelines is that we were not trained, we weren't given enough support, and we were being pressured not to. So don't internalize that sense of failure. Like the lack of support, the lack of the problems are bigger and beyond just coming from us. And I wish I had learned that sooner.
Oof, that's a really powerful note to kind of like send us off with. I think that's such an important reminder, and it's really hard not to get in that mindset, to get stuck in that mindset of being perfect. That's great. Wow. And yeah, that you learned that like you're not the problem here, and that it takes a lot of people working together to make a difference. That's all really powerful. Well, and luckily for folks who are struggling with this stuff, who want to do more, who want to talk about it, first of all, we have the link to Coventry Talk's Last Mile project in our bio. So after this, definitely check that out. So that's where you can find the information from experts and folks like Noelle about what are the best practices, what are the things that you would want to see in your workplace to keep workers safe. And then Coworker, we're really here to be a resource to folks who want to take action and improve policies in their workplace. So if you're not seeing those things and you want to like talk to someone about what you can do about it, feel free to reach out to us anytime. Definitely follow us on Instagram and, message us, whatever, all that stuff. And Noelle, just any this conversation could go on forever. And I know there's even more in your backstory too, that I would love to discuss. Maybe we'll have to do this again, but I'd love to hear if you just have any closing comments, and definitely let us know where folks can find more information and stay in touch with you and learn about all the important research you're doing.
Yeah, absolutely. The Coventry Talk website has still all of that public health information, really great hacks and guides and infographics to help people wrap their heads around learning to understand air ventilation. It helped me a lot. And we'll be coming out soon with some more detailed specifics, kind of more targeted to certain types of workplaces. So check out the website, or you can follow them if you search for Last Mile on Twitter or Instagram. Or here I am on Instagram or Twitter. So I'll make sure to post any of the new content that comes out myself as well. And
Awesome.
feel free to reach out to me if anyone has any questions. If I'm not able to answer it myself, I can definitely get some advice or a consult from a scientist or an expert who is going to have a bit more detailed understanding of some of the fine points. So I'd love to help in any way I can.
That's great. I mean, you hear all the scientific information, and it's really nice to have someone who can help translate that, and who has had the direct experience of like being a worker in this environment. So helping bridge those gaps it's a really important role that I'm glad that you're willing to play. Awesome. Well, thank you so much. Thank you to everyone who joined. Follow us at coworker.org, Team Coworker on Instagram. Let us know what other topics you want to hear discussed, what questions you have. And Noelle, thank you so much for all that you do and for taking the time to have this conversation with us today. I really appreciate it.
Thanks. It was great to do. Thanks for having me.
Great. Thank you so much. All right. Till next time. Bye, everyone.
Bye.